The show today from Spring Arbor University, both doctors of nursing, the dean of the School of Nursing and Health Sciences, Al Kaufman, and assistant professor of nursing, Mindy Rice. Welcome to the show, doctors.
Thank you.
Thank you.
Nice to be here. Thanks for having us.
Yeah, and every time you look around, the nursing program at Spring Arbor, it grows. And certainly got to be one of the most in-demand professions going.
Absolutely. Yeah. Absolutely. There's a shortage of nursing. There has been for many years. You probably know a statistic about that. I'm not sure the number.
Today?
For today.
It's like 58,000 positions in Michigan.
No kidding.
Yeah. So we have an important job, and we take it very seriously and excited to be able to help prepare the next future generation of nurses.
I know one statistic. Spring Arbor University has a 100% placement rate for their nursing students.
Yes, absolutely. That's I'm the director over the traditional bachelor's program, which is fairly a new program. This will be our 5th graduating class, and all of my seniors have job offers when they leave, and when they are walking across that stage, most of them have already accepted a job offer. So
that's great.
Yeah, it's really good.
Well, we invited you today because we wanted to talk about the Jackson Healthcare Workforce Initiative that was launched and announced by the Glick family and Alro Steel a couple of weeks ago. And I understand that you've been talking to, I think it even goes back when Al was still with us, about how the lack of trained healthcare professionals was impacting negatively our community.
Yes, Al Glick was very concerned about that, and his desire is that the money from his foundation would be used to fill the need in this county, both in, of course, in hospitals, but also address rural healthcare needs. And so we're proud to be joining along with Henry Ford Jackson and Jackson College, using the gifts that came from the Al Glick Foundation to prepare more nurses.
What does this mean? So someone that's maybe hasn't considered nursing specifically, maybe they've thought about it, having this opportunity in those partnerships, does that make it easier and more attractive for someone to say, oh my gosh, there's a path for me right here in town? Yeah.
So Spring Arbor University for a long time has had a path for those students graduating from Jackson College to come and get a bachelor's degree. But this particular gift allows us to educate people who are not nurses, not RNs already, who have a different degree and have decided they want to come back into a nursing profession.
There's a number of career paths in nursing and degrees and job titles. Where are we here in Jackson and at Spring Arbor? What do we have?
Well, so with this gift, our vision is to start another track or program called the Accelerated BSN program. So that's what Dr. Kaufman was just talking about. Somebody who already has a bachelor's degree in something might want to go back to school to pursue nursing in our case. And we will have that with this help of this gift. We're starting the planning and hopefully going to have that in place fairly soon. But we already have a traditional program, like I talked about, where it's a 4-year on-campus nursing program. Then we have a completion program. So if somebody is an RN with an associate's degree from, say, a community college, we have a program that they can complete their bachelor's degree at Spring Arbor. And then we have many tracks of a master's program. So we have graduate programs. And then we also have a doctoral program for nursing. So Spring Arbor really has anything that you could want. And now we're going to add this ABSN, Accelerated BSN, hopefully soon.
Oh, a lot of growth. And you came to Spring Arbor 17 years ago. Was there even a nursing program when you started?
There was a nursing program. It had been running 4 years, I think, at that time. We had one track. It was the RN to BSN track. So everything else has come after that.
Well, you brought some photos of some of the labs and classrooms and facilities, equipment. There's a lot of hands-on in nursing education.
Absolutely. Yeah, we have a lot of simulation equipment, so we give our students experiences in a controlled environment where they can, they can mess up as much as they want, and we can help them figure out what could go better next time. So these are some of the pictures that you're seeing now is our simulation lab. And
one of the things that many people don't know, if they haven't been to a simulation lab, these are very lifelike scenarios that we can
they'll scream
create.
if you poke them around.
They talk.
Yep.
Their pupils dilate and constrict. They have heart sounds, lung sounds, bowel sounds. We can give them medications through IVs, and they're very effective. We record them with the students in the room, and then it allows us to play that back. They can watch themselves. Their peers can critique them and learn, and all of that before they get to a real person.
yeah.
Testing it out on the dummies. But
Yes.
do they have names? Do you name
Oh
them?
yes,
Yeah?
yes.
Who's this guy?
They all have names. Is that Hal? No, he doesn't have a name. Our high fidelity mannequins, the ones that breathe and do all the things, they have names. But our lower ones, they don't. They're more generic. Yeah.
Now, you not just nursing. I mean, you have a health sciences.
Yeah.
It's a whole department.
Correct. We have pre-PT, pre-OT. Numbers of students in our science program are particularly the bachelors of science, go on to med school, dental school.
Now, being able to offer the accelerated BSN here at Spring Arbor, what were students having to do prior to this being offered now? Do they have to go out of town?
Oh yes. Yeah. So I think we found there's about how many in Michigan?
I don't know the exact number of how many there are, but you would have to go at least an hour from here.
At least
And many of those programs are more residential, and so students would have to move,
can't commute.
leave. It would be difficult. They're very intensive programs.
Do you work with do you have nurses that go on a rotation in like the hospital and stuff?
Absolutely, yep. All of our students go through clinicals, and we use Henry Ford quite often, as much as we can because they're the closest. But yeah, they get an experience in all different levels throughout their nursing career. And you know, one thing that I think is really awesome about this gift and the heart behind the Glick family and Mr. Glick's wanting to have a better healthcare in Jackson County, I kind of feel like I'm a poster child for this. I started at JC with my associate's degree in nursing, went to Spring Arbor to finish that, worked at Henry Ford, worked at Spring Arbor, and now I work at Henry Ford also again. And so that's the type of person he would like to give this kind of gift to, so that, and Henry Ford and JC are doing other things with their donations, but we're just so happy to be part of that and thankful that we can, you know, better the healthcare here in Jackson in our little own way.
In all three cases, all three recipients of the grants are helping students in some way, either financially, scholarships, providing more opportunities.
Yeah.
Right.
And it's competitive too. You only can take so many students.
Correct. Yeah, the state of Michigan, if we're talking about undergrad traditional nursing, gives us a number. We can always go back and ask for more. And as our program expands, I totally expect that to happen. We'll have to go to the state and say, can we have some more seats? But it is competitive because of that.
And obviously the need, we all know, as we saw through COVID, it's critical.
Yes.
Yeah. So you started, why did you want to be a nurse?
Oh, I kind of always wanted to be a teacher and a nurse, and look what I'm doing now. I'm teaching and I get to be a nurse. It's really amazing. But I do love the helping, the just caring for another human being. It's just kind of part of my nature. So, and I think I do that with my students too. They kind of think they have a second mom away from home. So, I get to practice in both my professions.
Al, were you a practicing nurse before teacher?
Yes. I have a hard time saying this. I've been a nurse. Next month it'll be 44 years.
44 years.
So yeah, I've worked clinical situations for 25 years, and then found an opportunity at Spring Arbor University to start as an adjunct, and figured out quickly I really enjoyed it. I should have known that. A lot of nursing is teaching. We're constantly teaching patients, teaching family members, and there's a lot of reward in that teaching component. So,
What got you into nursing?
so remember how long I've been a nurse. At that time, there were orderlies, and I worked as an orderly in a nursing home in high school. And I liked science, I liked human science, and I liked helping people. So it was a natural fit.
And when you started, nursing was a very heavily dominated by a female profession.
It was. I was an anomaly
Yeah.
at the time.
Yeah.
Yeah. But it's,
Yeah, because people used to call you not nurses, male nurses.
Yeah. Yes, that's true. But it's a great career. An interesting thing about this particular track that the Glick Foundation is helping us start is you'd be surprised that the two major groups of people that come into this are people with a science background. You'd expect that. But the other one, it was a surprise to me, it's people with arts and humanities degrees. Almost the same number as science degrees. So typically there are people that have been out of college 5-7 years. They want to do something more. They want to help people. They want purpose. And nursing provides that opportunity.
I think nurses are amazing people, and they do so much more than just providing the clinical care. Like you said, you're the mom to the nurses. I think a lot of people have had experiences with nurses who've really developed personal relationships with their patients.
Yeah. The interaction, the caring, it's interesting that you were talking about what veritas means. We teach veracity in nursing. We teach that as a standard of practice, to tell the truth. That's just one of many. But those really important human connections are, helping the patient, but they also help me as a nurse too.
Well, we greatly appreciate you being here today and all the work you do and taking care of our community and educating our kids.
Thank you.
And adults.
And adults, yeah. That's right,
absolutely.
not just kids.
The whole lifespan.
From Spring Arbor University, Assistant Professor of Nursing, Dr. Mindy Rice, and the Dean of the School of Nursing and Health Sciences, Dr. Al Kaufman.